Good morning. Welcome to our panel this morning on vaccine variants, distrust and myths. My name is Kinglsey Gobourne. I'm the Chief Equity and Engagement Officer at GHC, and I'm honored to be your moderator here today. Joining me, I have an esteemed panel of panelists that I'll quickly introduce, as I know we want to get right into our conversations this morning. For us, we have Ashok Rai. He is currently the Chief Executive Officer for Prevea Health in Milwaukee, Wisconsin. We also have on the panel today Dr. Aurielle Williams. Dr. Williams will be joining us from his role as a director both at St. Joe's and also Elmbrook, also located over there in Milwaukee, and Aurielle Smith, Deputy Director of Policy Planning and Evaluation for Public Health, Madison and Dane County. So welcome, everyone, and thank you so much for joining us today.
Thanks for having us.
Great to be here.
So as I shared, and we were talking with the panelists today, I recently joined healthcare, and my time in healthcare has really spanned the COVID crisis that we're really dealing with. And we've reached this really point in our country and in our conversation and in dealing with COVID where vaccines are right at the top of the conversation. And so I really want to kind of jump in today and quickly ask, and we'll start with you, Dr. Williams. Can you discuss what you believe to be the underpinnings of vaccine hesitancy in communities of color? And kind of more importantly, how are those hesitancies different from those who are maybe anti-vax or from other communities, knowing your role with St. Joe's and Elmbrook? So
to start with, I would say, the underpinnings of vaccine hesitancy, especially in communities of color, this goes back probably 300-400 years, right? There's a built-in distrust, and we can name numerous examples of bad things that have happened to folks of color throughout history of our country. The more well-publicized things such as the Tuskegee experiment, in which Black men were, infected with syphilis and basically treated like lab rats. And an apology didn't come until the Clinton administration. And by that time, almost all of those patients were dead except for a couple. And I think I saw one little old man get an apology from President Clinton. He was almost 90 years old.
Wow.
But and then you have other cases such as the case of Henrietta Lacks. Now, when I was a student in Milwaukee Public Schools back in high school, and I won't say when, but it was in the early 80s, and we were taught about the HeLa cell line in biology and advanced biology, but we never got any of the background behind what the woman herself. And so this was an African-American lady who had breast cancer, and her cells turned out to be immortal. They kept dividing and proliferating, and they were studied over many decades. Many pharmaceutical companies reaped billions and billions in financial rewards, and the family, not until recently, were even acknowledged as, being their heirs and so forth. And so, examples like this abound throughout history. Okay. And so you have a distrust there, which is distinct from the anti-vaxxers. And we can go back maybe 20 years and where we've seen the beginnings of anti-vaxxers when our kids went to school and had to be vaccinated. And the example came up, the rate of autism has gone up and using correlative data, of course, which is very dangerous and very misleading, by the way. They said, all these kids got these vaccines and the rate of autism went up, and now I don't want to vaccinate my kids. And so there was a fear that kind of was, originated at that point, I think, and maybe even before that, but certainly that didn't help the situation where people who are staunchly anti-vaccination, they again, and I think the reason for this, the underlying unifying factor in all of this is disinformation, right? And we saw this This goes back to the 2016 election where, foreign entities were bombarding our social media with disinformation about the candidates. Well, this also continued into the COVID pandemic as well. And I would argue that some of this disinformation was targeted. And so, we don't know what everybody's agenda may or may not be for spreading disinformation, but understand that even in the anti-vaxxer population, I've gone through my 5 stages of grief and anger about it, but then came to the realization that people really are victims of disinformation. And now, when we were kids, Walter Cronkite said something on the evening news. You knew it was true. It was double checked. It was verified. The sources were verified. And now we've kind of evolved to a society where people no longer seek information or objective information, but they seek affirmation. They if you go on your smartphone, you punch up a video, it'll take you down a rabbit hole. And based on the algorithm, you'll get bombarded with things that program thinks that you want to see. And it's not necessarily factual, or it's half truths and these types of things. And so this is the situation that we're dealing with now in this pandemic, which is probably the worst time that this could ever happen, where you're seeing disinformation, the politicization of a virus, and people are making stands not based on science or true data, but basically on emotions and feelings, and again, based on disinformation. So I think, it's a combination of these kinds of things, and that we're seeing this manifested now in the middle of a pandemic where we have 700,000 plus of our fellow Americans have died, and we've all become desensitized to it. So.
Right. Wow. You said a lot of great things with Dr. Williams. And I'd kind of like to turn now to Dr. Rye to kind of follow up on what is the impact being on our healthcare systems? What are you seeing from this disease, as well as from these new variants? And I will also comment that, you've done a lot of work educating on the schools and wearing masks. So maybe talking as well about the spread and the communicability of this virus.
I think it's difficult from a healthcare system standpoint to separate COVID-19 from all of our other issues, especially when it comes to our Black and brown populations. Healthcare has generally failed our minority populations over the years. And if you don't feel like systemic racism exists in healthcare, I could talk for about 6 hours on giving you examples of that from the time I was trained to where I was trained. And where I practice now, and actually I'm not in Milwaukee, I'm in Green Bay, just to clarify that. So, where the minority population is small but strong, and but because of that, we can see the disproportionate care. In Milwaukee, things are a little bit more blended because we have a much larger Black and brown population. Same in Dane, but when you come to populations in Green Bay, a huge magnifying glass. So you talk about the onset of COVID-19. It started out in our district as a Black and brown disease because it was in the meat plants. It was in different manufacturing areas traditionally populated by our Somalian population, our Hispanic population, our Hmong population. So, it got attention, but it also, you could see racist behavior even in how that was handled by employers and really from a public health perspective. So we started the mistrust at the first diagnosis, if you really think about it. And it's just continued on top of a system that there's a lot of mistrust anyway. So I agree with everything that, Dr. Williams said and how that information is then used against us. So we saw the destabilization of the United States economy in March through May of 2020, like we've never seen before, right? Economy shut down, markets didn't respond well to that. So if you are a foreign body or a foreign policymaker, how do you keep America down and continue to keep the pandemic going, right? So you feed mistrust. And then you feed mistrust to the most vulnerable. Because if you can affect the most vulnerable, it will continue to affect the economy at that basic level, which then everything is built upon it, employment, manufacturing, etc. So it's very strategic to create mistrust within the Black and brown communities, to make this, to continue an economic collapse. So a lot of what we're experiencing right now is taking advantage of decades of weakness, decades of inappropriateness, and then an acute situation where it definitely targeted. we look at our death rates, if we look at our access to healthcare, COVID-19 put the biggest magnifying glass ever on how healthcare isn't delivered to our Black and brown communities. And vaccination has been a very difficult uphill climb. There's a trust level that wasn't there. There was a trust level issue at the beginning of the pandemic. And in all honesty, science evolves, and not people, and the basic understanding of that doesn't exist amongst our populations. That we are going to change our methodology as we learn more. And it makes us look like we're changing direction instead of the normal scientific evolution, which we're going through. It's how Dr. Williams and I were trained. You know, there are things that we were trained that we would never do today, right? And there are things that when we were training, you would never give a beta blocker to somebody with heart failure. Now, if you don't, it's wrong. So, I mean, that scientific evolution wasn't there. So you put it all together, you know, the amount of mistrust is exemplified, you know, exponentially right now. So whether it's a mask, a shot, or policy around healthcare, all of it, there's some mistrust. And then that mistrust is layered upon an infrastructure that was never designed to appropriately take care of our minority communities. So why is it exponential for Black and brown communities? It's twofold. It's what Dr. Williams talked about and what I just talked about, systemic issues and access issues. Combine both. And if we don't solve for that very quickly, COVID-19 very quickly becomes a disease of the Black and brown. And when that happens, people stop caring. And let's just be honest about that. We see that. Research funding goes down, media goes down, unless it affects everybody or it affects the economy. We need to react faster than we're reacting right now to this, to the problem.
Wow. Thank you so much. That is powerful. And I almost want to just take a moment and just kind of really let that sink in and what that actually means for our communities as we move forward. And as we talk about communities, right, I'm gonna now turn to Aurielle. Please talk to me a little bit about the work that's happening right now to, one, educate our communities, and then provide resources. I think one of the things that have come up so far is that there's a lack of resources, there's high distrust, and how is that affecting the work that you're doing at Public Health?
Yeah, great question. So education is really a cornerstone of public health, right? We want to make sure that the public has the education and the knowledge that they need to make informed decisions. And then the back end of that is making sure that they have accessibility. And historically, we know both in public health and in healthcare, we haven't done the best job with accessibility, right? What is accessible for one group of individuals does not mean it is accessible for everyone. And for a long time, that's been really based in geographical location, right? Accessibility has been seen in that way. And we, this year, especially with vaccine rollout and last year prior to that with testing, have been intentional about what we mean by accessibility. And we've been able to really hone in on our communities of color here who talk to us about accessibility. So for example, when we stood up the Alliant Energy Center last year that was mostly focused on testing for the first rollout and then later vaccine, we heard loud and clear from our Latinx population here that they had still significant concerns around immigration status and ICE, and with services being delivered by our National Guard, and even with public health, we're a government entity, right? They had concern that we were checking immigration status and that we would report them to ICE. And so we really worked with our partners in our Latinx community to find out how or what were the best ways we could overcome that accessibility. And I think for us as an agency, that's really also been a humbling experience, right? I think many times as a government entity, as a public health department, we balance both authority, regulation, and what is the best health or outcomes we are looking for our community. And when we hear from our community that what we're doing or what we're trying to do isn't working, it's a humbling experience to learn and adapt and make good on our cornerstone values of health and racial equity as to how we're really going to do that differently. So we've definitely pivoted strategies over the last 20 months and will continue. In some ways, it's our scientific evolution of as we learn more, we do more and we do differently, right? We are not going to continue to do the things that we've always done the way we've always done them. And with that, we've been able to make some strides around education, especially around anti-vax and vaccine hesitancy in our communities of color. And while the historical distrust in governmental institutions and in healthcare, that is real, and that is foundational. We have also learned there are umpteen amounts of other hesitancies that also play into that formula that we had to address, right? And as we as a team had to really hone in and center on, as much as I would love for us to do and champion, we are not going to be able to fix 400 years of racism in the middle of a pandemic. I mean, more power to us if we do, but that is not the goal I'm going to set for us as a team, right? And really realizing that there are additional hesitancies that play into that formula of why someone does or doesn't get vaccinated that we could focus on too, right? Not to ignore the historical distrust, but in addition to that. And right, we were able to do some education around vaccine safety concerns, right? It was developed so quickly. What does this mean? How do we take all of the scientific data and knowledge and information and studies that we get from the Moderna vaccine, from Johnson & Johnson, and how do we make that understandable to the layperson who does not have a degree in pharmacology and try to get some of that information. So we've done a great job with that. In our Black and Brown communities, a lot of women expressed concern around fertility and pregnancy. As we know, Black women especially, we have some very deep-rooted issues with how we've been treated in healthcare and how sometimes our complaints and our challenges and our what we may be experiencing symptom-wise isn't always taken seriously. And so that was a big concern that we started to see around fertility and pregnancy questions. And so getting people the information that they need around that for family planning purposes. We also had to overcome logistical conflicts. This was a big one for us, right? Alliant Energy Center was open from like 8 to 8 in 12-hour days. For those in healthcare, that's normal. For us in public health, that is not normal for us. And so even realizing 8 to 8 doesn't work for everyone, right? We have a lot of people of color who work off hours, who work night shift, and they still need access to care. And how are we going to do that? And so that's one way we really tried to hone in and match education with helping to make informed decisions, and also educating ourselves and how we do better to deliver that care and really address access, not just from a geographical standpoint, but from what does accessibility mean for different communities of color, but also the individuals within those communities, because we know that that is also different. And we can't just make one lump sum for one group of color. That is not going to work.
Thank you so much, Aurielle, for sharing that with us.
Yeah.
And it's a little scary to think about when you start piling all these basically intersectionalities on top of each other. It becomes really difficult, and some of the barriers are a little bit clearer. Dr. Williams, I wanted to talk to you quickly just about, there's a lot of conversations around mandates and mandating the vaccine. And that has gone, there's individuals on both sides of that don't feel that mandates are necessary. Can you talk to me about how you've seen mandates work, what your thoughts are around mandates, and when we think about the populations at risk and how difficult it is for them to get access, what can an employer, what's the role of the employer in mandating these vaccines at the workplace to help ensure that they're protecting all populations?
Sure. Well, I can only speak to healthcare, because we've heard of mandates, throughout other business sectors in the country as well. But I would simplify it to this. I would say, look, it is our job, and understand, I work for Ascension, and we are a Catholic organization. Even the Pope has chimed in on this to say that this is a morality issue. It is for the common good. There were questions that came up about the research, what went into the research behind the vaccines, were stem cells used, et cetera. And even the Vatican had chimed in on, that we didn't actively do the research. However, we know that this is for the common good of humanity, and it becomes a moral issue. Think about this, if you had an ailment, and let's not even talk about COVID, for instance, because we know how COVID has strained our healthcare system across the country. Now imagine you or your loved one has chest pain, and has to go to the hospital, and now they can't be seen because our resources are so devoted towards taking care of people with COVID. Okay, that puts the patient at risk on two fronts. Number one, you want to make sure that your healthcare providers are vaccinated so that you protect the patients. And that is a moral obligation. In my view, it really is. That's part of the Hippocratic Oath, is to do no harm, right? And if I'm a provider, provide and care for somebody, and I'm getting in your face and doing an exam and everything, and I'm not vaccinated and you're not either, I may be one of the lucky ones, the 80% people that doesn't have symptoms, but you can still spread it around. So now it becomes a public safety issue. Okay, so in that regard, mandates are absolutely warranted. I strongly agree with them. Again, it gets to a point where you say, okay, yeah, Americans, we are staunchly independent to a fault, right? I'm not going to be told to wear a mask. I'm not going to be told to have a vaccine. But I think Jerry Jones, the owner of the Dallas Cowboys, said, all of that stuff kind of goes out the window when you're talking about the common good. Okay. And again, you still have to take into account people who are victims of disinformation, right? We still take care of them because that is our moral charge to do so. And we do so willingly. But at the same time, you have to wonder sometimes, people start to get a little frustrated and understand that this pandemic has been going on for 2 years. Okay, folks are getting sick and tired of it. They don't like to wear masks. I feel like I'm impinged upon and so forth. But again, look at my personal situation. I have 2 little girls. Both of them are below the age in which they can get vaccinated. Okay, even though I'm fully vaccinated, I contract it from somebody who's not vaccinated or somebody who's infected. I can still spread it to them, even though I have no symptoms and I'm vaccinated. So when you look at this in its totality and you understand, what is the rationale behind mandating, is because at some point, we have to get off of that me society attitude, which Americans suffer from almost to a fault. We want to be independent. We don't want to be told what to do. But when it comes to the common good, now we have to start talking about doing mandates. And now it becomes a choice for people, right? You have to say, okay, in many instances, it's a condition of employment. If it's mandated, then people have to make a choice. And then there are consequences to your choices if you choose not to be vaccinated. And it's so vitally important right now, because again, it's not just people of color. There are other people who are vulnerable, people who have pre-existing health conditions, the elderly and so forth, people who are immunocompromised, and we still see some breakthrough infections with them, even though they are vaccinated, but the rates are much lower. So we have to go back to the data and look and say, hey, now in this 4th surge, had people been masking and got vaccinated early on, we wouldn't be talking so much about the Delta variant or the next variant that's coming down the pipeline, because there probably will be one, because we still have millions and millions of people who want to be staunchly independent, and I'm not getting no vaccine because I'm just not going to do it. Okay, but then understand there are consequences to that as well. And what if it happens that you didn't get a vaccine, but now your grandmother catches it from you and she dies? Okay, these are the real hard questions that we have to start asking and telling people that, look, you have to protect not only yourself, your loved ones, but each other in our community. So, I know that was kind of a roundabout answer, Kingsley, but I'll tell you what, this is vitally important right now. History repeats itself, right? And we learn lessons from history, but every time we learn the same lesson, it is more painful. And this has been exemplified by this pandemic because we've had 4 surges. Each surge has taxed our healthcare system across the country beyond what it was designed to do, as Dr. Rye had alluded to earlier. We're not designed to take care of people like this in these numbers, okay? Therefore, other people's health issues start to suffer because the resources are being used up on this level. So,
Dr. Williams, thank you so much. And Dr. Wright, your name just came up, and I kind of like to turn to you on this. Is what is the future? what does the future look like with COVID, with these variants? And we've seen an introduction, boosters being approved now for that third dose. Could you talk a little bit about what you think the future looks like for COVID? And if we get to that place where that is better, right, more operable, less strain on our resources, what does that look like, if you could share in your mind?
Well, the goal is to go from a pandemic situation to more of an endemic situation. We're not going to be eliminating COVID-19 off the face of this earth, especially due to a lot of the hesitancy issues and et cetera that, Dr. Williams, myself, and Aurielle also mentioned. So, it's how do you get to a certain level of immunity within a community to drive this down so it's not overwhelming the health system and we're not seeing a level of death. So it's a multi-pronged approach. Part of it is through vaccination. Most of it's going to come through vaccination, the best form of immunity. And I know a lot of people want to have a debate between natural immunity, i.e. getting COVID and how immune am I versus the vaccine, but the data is pretty strong and the CDC would lean you towards getting vaccinated even if you've had it, at least, looking at it as almost super immunity if you get both. So it's, how do we get our vaccination numbers up? We've had a very large percentage of our population unable to receive the vaccine. One of those is a picture behind me if I looked up, and a couple are right behind Dr. Williams. It's our children. And as we look at 5 to 11 pediatric vaccinations rolling out, I think logically, if I look at all the dates, probably first dose is the week of November 8th, probably somewhere in the middle of that week. But also understand that there are thousands of children in the state of Wisconsin, millions of children in the state of Wisconsin. And that's not going to happen in a 2-week time period. It actually takes 5 weeks to be fully vaccinated. So as we look at the crystal ball, we're not going to reach a level of immunity within our community to reach endemic stages probably until spring or summer, when you really start to look at the timing for all of this. So we have to continue our mitigation. And we're also going to have new treatments that are going to make this easier for us going forward. If the Merck pill if the data is as good as they say it is, now I've got a chance to review the cursory data, but Dr. Williams and I haven't had access to the full data set, which the FDA will approve we'll look at on November 30th. Then we'll have an oral medication we can use. All of those things are going to help us reach a level of control. And it comes through treatment, and it comes through vaccination and some community immunity through natural infection as well. So logically, crystal ball, we can accelerate this if we can accelerate our vaccine status, but there's a large population that we're just starting to do, and you can't logically try to figure out how to do that in a 90-day time period. It was interesting yesterday, the White House put out their vaccination plan for 5 to 11. And I'd like to talk to whoever created that plan, because they've obviously never run a healthcare company or practiced medicine. We're going to do it in the pediatric offices from the months of November to March. Now, Dr. Williams, I looked at how many pediatric patients we have just in Brown County that go to Burbank, about 16,000. Let's say we want to vaccinate half of them. That's 8,000 kids. That's 16,000 shots because there's 2 shots. Do you think I have 16,000 appointment slots just sitting there open over the next 90 days during the busiest time for pediatric infections with respiratory infections? We have to create mass vaccination for kids and figure it out quickly. So we don't have the right people making decisions, and that's not a political comment. That's nailing both parties on that one. And they don't talk to us. So crystal ball, which you asked me to do, it really depends on how healthcare steps up now. It isn't about the government stepping up. They've already proved themselves to not know what they're talking about. And I hope they're watching. But it really comes down to healthcare stepping up and working with public health and solving towards these problems as quickly as possible. Crystal ball, though, to get to endemic, don't expect it to happen this winter. Expect parts of life to be normal because you have a level of protection. So if you're smart and protecting yourself, you've been vaccinated, you got your booster if you're eligible for it, you can have a pretty normal winter and travel, go to a game, all of that. Just be smart when you do it, mask when you need to. I'm not saying that we shouldn't be living our lives. I'm just saying life won't be normal this winter. And I think people are expecting it to be with all of the announcements this week on boosters with Moderna and J&J, the committee's meeting and pediatric, vaccinations being approved, sometime after the first week after Halloween. And everybody thinks that's going to be like a magic switch and, life is going to be normal. But I think it's good to kind of lay out a plan and set realistic expectations. You're looking at spring and summer.
Yes, I'm looking forward to having an oral option, for the vaccine. And if they could put it in ice cream, I tell you, I would have no problem with the boosters. I would take
let's just make sure that we know that it's not the vaccine that's oral, it's a treatment pill.
The treatment,
you still would need to get vaccinated even after being treated. And that's something that's an education piece that we just need to keep hammering home, is that even after that natural immunity, 10 days after, or after your 10 days, we still want you to show up for your vaccine if you're unvaccinated. That's the level of protection we need to prevent variant creation, to prevent breakthrough infections. So it's that level of education. We need to break it down to the level that people can understand. And there's a better expert on the screen. I'm pointing up to the corner because that's what she is, because, natural public health is trained in education as we are, but, a lot of this is going to have to explain that to people. Why do I need a shot if I already got the bill? You need the shot if you got the pill. Yes. And we're going to have to explain that. And if you're shot adverse, let me just point out, this is a very tiny dose, much smaller than any other vaccine you get. This is probably one of the easiest vaccines to receive in an arm, and it's nothing to be scared of.
Yes. I got the vaccine as well. It was 2 quick pokes. To be honest, the second time, I didn't even know it occurred yet. And so, from that standpoint, it went much better. And this is someone who's, again, opposed to needles. So, Aurielle, we're finding out that this is going to be around, right? So this pandemic isn't going away, right? Tomorrow it's going to still be here. Easter, it's still going to be here. So in public health, what are you doing, or what can we do? I guess I should ask you, what can we do to support the efforts that are going on in public health? How can us as individuals in our communities share that information, and where do we get it from? Obviously, hopefully everyone is tuning in this morning and getting some of this great information. But if they're not, where can they go, and how can we help support those efforts?
Yeah, great question. And you're right. This is not going to end anytime soon. We are pushing to hopefully get to that endemic stage, or that stage where it's manageable. But we here at Public Health, we are preparing to kind of open COVID with a welcome arms as another one of our communicable diseases that we've got to keep track of moving forward. And so with that, yes, we are always in the business of, we will take whatever help we can get, which is what I like to tell people. And we're really thankful to the community here in Madison and Dane County. We've had incredible partners, and actually also partners all over the state and all over the country who have been willing to think about things differently, who have been able to thought partner on education and outreach methods that have been successful in other places. And so with that, I think what we would really love to see more help in utilization in is just getting the information out there. And I think one of the things we have heard that has been pretty successful is people sharing their individual stories, right? If you and I are friends and you're a trusted individual in my life and you tell me about your experience with vaccination and I'm hesitant, that's going to maybe help me work through some of my reasons I haven't gotten vaccinated. And, this has been a little taboo for us, but we are seeing it work. Even with those who have had concerning experiences, we have tried to really set up mechanisms to let us know what we could have done better or differently. And we use we as the collective we here, right? That's we as public health. That is we as healthcare. That is we as everyone who is in this pandemic. As I like to say, we are all in this together, whether we want to be or not, right? And so anything we can do, if you had a negative experience, let us know, right? We can advocate. We can have conversations with healthcare. We can have conversations with our staff about how we can be doing things better, because the last thing we want to do is add another notch in that list of problems we had earlier of why people aren't getting vaccinated or why people are in this mode of maybe not taking COVID as seriously as we need to. And so that's really, I think, some of the ways in which we've been looking for help and kind of utilizing the help that we have here. And I would say just also taking care of yourself, right? And there is a little bit of this that is airplane policy of put your own mask on before you help somebody else. And we're also trying to encourage people to do that, right? If you are sick, stay home, even if you don't think it's COVID, right? I keep telling everyone the last thing we need is another pandemic on top of the one we are fighting. Right. So take care of yourself, right? If you're feeling sick or under the weather, stay home. Do what you need to do to take care of yourself and your family. If you are ready to get vaccinated, go get vaccinated. If you're not sure where to get it, call us, go to the website, we've tried to wrap around where people can get vaccinated or tested if they need to. And then, kind of once you've settled yourself and you feel comfortable in your space and where you are, then start to outreach to others, right? Again, we are all in this together. And the more we can continue to outreach and educate within our own bubbles, eventually we will have all of the bubbles covered. And so that's really where I have to give a shout out to our community leaders and partners here. They have really done a wonderful job with making sure education, information, access, treatment if needed is readily available and getting that out to their bubbles. And so that would be my encouragement. And then I'll also put in a shameless plug of public health, not just us, but us included, everywhere is usually hiring or looking for volunteers. So if you are at that level of wanting to help, come let us know, right? We could always use some more help, especially if you have unique insights, and especially if you are a person of color. I will do my own selfless, shameless pitch of we could always use more people of color in public health. There's not enough of us in the field.
Well, thank you so much. And that is important. I don't think that was a shameless pitch. I think it's important when the message is coming from someone that you can trust. And oftentimes, if the message is coming from someone that is outside of your group culturally, racially, ethnicity-wise, it could lead to some of that distrust because we don't know what motives everyone has. Something that you brought up, though, was around the conversations, having that conversations and continuing to share some of our experiences. When you hear negative experiences out there, and Dr. Ryan and Dr. Williams, please jump in. This is for everyone, not just Aurielle. Where do we go with some of that information right here? And I want to share just, we've all been on Facebook. We probably all deleted some friends or people we thought were friends over various issues in the last 2 years. And I'm sure COVID might be one of them. But besides doing that, right, because that sends everyone back to a corner and they're not getting any information, right? Their sources are now limited. So without doing that, what are some ways that we can direct the conversation? And when we hear some of these myths and not even myths, but things that happen, right? People getting sick after the shot. Let's focus on that one. When someone's talking about getting ill after shot, what is the expectation of when you take a vaccine? What are the things that are likely to happen? And Dr. Williams, I see you raise your hand, but I also see Dr. Rye. So we'll go Williams and then Dr. Rye after that.
So one point I wanted to make, and this, and I don't mean to step on anybody's toes here. So Dr. Rye or Aurielle, feel free to cut me off. Sometimes I take a tour of the galaxy, but I will say this, to try to keep it in perspective, understand, all right, let's talk about other FDA approved chronic illnesses like Lipitor. All right. You could say, well, okay, before whatever drug manufacturer, whoever it was that made Lipitor, they went to the FDA, they studied that drug on probably, and I don't know the exact number, but let's just keep it in perspective, 100,000 people. Okay. And you see the TV commercials, people dancing in the streets, my cholesterol is lowered. And then towards the end of the commercial, you hear some guy talking like an auctioneer. If you have then side effects, then talk to your doctor. Okay, so understand that, keep this in perspective. 100,000 people to approve a drug that is used for years to treat high cholesterol. Now we're talking about a vaccine which has been administered to. There's been not this many people, but doses wise, we've administered almost 400 million doses of a vaccine. Okay, so exponentially more people have taken this vaccine than were tested on some of these other drugs that we use every day. Okay, and the side effect profile for the vaccine is long, whereas Lipitor or Januvia or whatever, there's 2 pages of side effects. Okay, but people, they don't connect those dots quite, right? So if you understand, a vaccine is supposed to elicit an immune response that tells you that the vaccine was actually a vaccine and that your immune system is working. Okay, so you should expect to have, oh, I took the shot and I got the flu, or I took the shot and I got COVID. Well, no, the vaccine does not give you the flu or COVID. It will elicit an immune response, and you should expect to feel a little under the weather for 12 to 36 hours. Far preferable, in my opinion, to being on a ventilator for 3 months, okay, and maybe not making it out of the hospital. So, we really temper, the way that we disseminate information to Ms. Smith's point, and try and keep it in perspective for people so that they understand, look, this vaccine is safe, it's effective, it's probably the most effective and safest vaccine ever created and probably in human history, other than maybe the polio vaccine, which was in a nice little sugar cube, which is very tasty, by the way. I remember getting that vaccine as a little kid thinking, boy, I wish going to the doctor was this pleasant all of the time. But again, you have to keep it in perspective. And so when people talk about, oh, well, I've heard of people getting blood clots from this vaccine. Well, guess what? The rate of blood clots from COVID-19 infection is much, much higher. So again, when people harp on the side effects and use that as an excuse to say, I don't really want to take that shot, you have to understand what a vaccine does, how it works in your body, how it elicits an immune response, and what your symptoms are going to be as a result of that. And again, can't be overemphasized, post-vaccination syndrome is 1 to 2 days, whereas COVID infection, if you're not vaccinated, you end up critically ill, you might not make it, or you're going to have some serious sequelae of the disease if you do make it, and you happen to be one of those people that gets really sick from it. So, all right, I'll yield the floor now.
That was great. Thank you so much, Dr. Williams. Dr. Rye.
All scientists learn and all communicators learn, and I've made a lot of mistakes over the last 2 years in communication where I wish I could have unwound a conversation. I had a chance to speak to some professional athletes even around vaccination. And what I've learned, especially when dealing with communities that don't trust healthcare, and that's what we're addressing today, right? Our Black and brown communities have no reason to trust us. We have not earned that trust. We, in a lot of cases, don't deserve that trust because of our behavior over decades. So when somebody doesn't trust you and then they bring to you a problem, I think it's really important for us to acknowledge that and not to talk in absolutes. So sometimes as scientists, we know that that's kind of impossible. Like somebody brought up a question to me about long-term issues on this vaccine when it's only been studied for a short period of time. And I brought up that no significant long-term issues ever been shown in a vaccine in the history of vaccines post 6 weeks administration. That's an absolute. I shouldn't have said that. I should have educated around there's still a possibility. And I think open and honest conversations about possibilities, although rare, and doing them as rare, is better than talking in absolutes because we have to build trust. So you build trust by recognizing the person's suffering, acknowledging it, never diminishing it, and then walking them through the why behind it and helping them explore if they're still experiencing symptoms, even if you know, based on our science and our training, that's likely not, there's probably zero chance of that being vaccine induced, but they're having an issue due to something else. Don't discount it. Examine them, talk to them, get an appointment. I think all too often we forget in our communications as scientists, and I've had to learn this the hard way. And by the way, I had to delete Facebook thanks to all the threats. So I don't know what they say about me anymore. It's so important for us to come from a perspective of trust building. In all of our communication and all of our statements and all of our Q&As, we have to come from it from a very different perspective, almost a non-scientific perspective, and really come at it from a humanistic perspective of understanding the person in front of me had the guts to ask me a question in a Q&A, which is awesome. Recognizing the fear and anxiety it took, and then the fear and anxiety of what's going to come out of my mouth. And trying to just relate to that. And some of the best experiences I've had with the Black and Brown communities is church. So how did I decide personally that I was going to go out and access education to our communities, the minority communities? We aren't, like I mentioned, I'm in Green Bay. The infrastructures here are much smaller than they are in, say, larger cities. One of the best infrastructures I had, especially with our Hispanic community, was church. And I had the bishops and the popes back up on this one, common good. And great Catholic churches here that are predominantly Hispanic. They have Hispanic-only services and priests that would let me speak at the end of that. And I realized I was there and I was in a trusted environment. I was in a safe environment for them. Me, probably not that safe, not always the good boy waiting for the lightning to hit me in that building. But, it's a safe experience. It's a safe place for them. It's a trusted place for them. So choosing places to have this conversation in a sterile exam room or a TV screen isn't going to develop trust. And, we had this theory that we had 2 phases of vaccination. Mass vaccination sites, people will come to us. And then part 2 was, all right, time to bring the needle to the arm instead of the arm to the needle. And we have 2 phases of that. And with our Black and Brown communities, we have to recognize our very distinct phases and how we operationalize that. But it all starts with the communication around trust and where are they going to trust us. So it's important to recognize you're going to feel like crap for 2 days. It's also important to realize that they may have felt lousy for a different reason for 5 days, and that we have to communicate around that and teach around that and set expectations without talking in absolutes.
And I think too, if I could just add quickly, maybe a pro tip for those out there who are serving as community leaders or even yourself, right? Airing the challenges you are having or the experiences or the negative ones on Facebook, it's going to get lost in social media land, is what I like to tell people. And so we have been trying different methods to really get people to communicate that feedback to us directly, not via the Facebook channel, because as you can imagine, as public health, we have to weed through, right, a lot of commentary on everything under the sun, including mask mandates, right? And so that's where I would really encourage and empower everyone who is a part of the session and everyone outside of this session, especially my people of color, to, if you've had a negative experience or you've had an adverse experience or you wish you would have been communicated with in a different way, or you would have had more information, or you wish you had known something in advance, I encourage you to find a modality other than social media to communicate that with the healthcare system, with us as public health, if you don't feel comfortable in that clinic setting, with a trusted member who has that connection back to healthcare, because that's the information and feedback that we all need to make different decisions, to operate differently. And we don't always see that in the noise of social media, as I like to call it. And so the more we know, the better we can do, is the tagline we like to use here.
Well, that's great. Thank you so much for both responses. Dr. Wright, did you have anything else to add to that?
No, I was going to say the best day in healthcare in the last 2 years was the one day that Facebook and Instagram went down for 24 hours. It was like by far the best day in healthcare. It was like, could we maybe get that 3 times a week? But
I was convinced one of our staff had done it. I was so convinced one of us had hacked it.
I think all of healthcare, if we figured out a way to do that, we probably would violate some laws, so we shouldn't do it. But it was a blessing of 12 hours of no social media. And, I just, going back to what Aurielle said, it's not the place to have the conversation. It's not the place to engage. And it's definitely not a great place to educate, because what happens is you educate and then you open up the door for misinformation. You open up the door for, because people, the algorithm, the bot, whatever it is, the person down the street is looking for you to do that. And so they can pounce on it with misinformation. So we have to take the conversation, like I said, to church, to community centers, to work, to, to schools, to neighbors, I will love just go door to door and to everybody unvaccinated and have a conversation. That's how we get through the misinformation. That's how we educate.
And I think that's so important to hear. You mentioned something, Dr. Wright, I want to also acknowledge is that the level of violence and response to vaccine mask mandates. You mentioned your life being threatened. These are all really serious things, and obviously wanting to make sure that when you're in those spaces, we talked about fear being part of this. So how do we manage that, right? For example, I will just share. I had my vaccine. I shared with some individuals that I was vaccinated. The first response I had was, "Did you stick a magnet to your arm?" Which confused me. I didn't get it right away. And then I was informed that they had planted this chip in me. Now, of all the other things I got to worry about in my day, I was now, having to worry about being being programmed and who's controlling it. Dr. Williams has now got this control over me. It's in those conversations where I think a lot of people feel that angst, that fear, and not knowing where to go. And that doesn't mean that we should combat or go back, but is there any way to direct that conversation, or do we just walk away when you hear these things and leave them where they lie?
I don't think you walk away. You try to take it off of social media. So most of us have friends on social media, which also means we probably have their phone number or the way to direct message. Take it personal. Take it, this is a new weapon in America, a keyboard.
Yeah.
And there are a lot of keyboard warriors out there, and you have to disarm them. You have to take the keyboard away, and we have to go back down to our roots. We are people. We want to be communicated to, and a relationship is there. It needs to be established. So I think it's important to use social media for broader, alerts, like we're going to do X, we're going to do Y, but leave the communication to be a lot more personal. And when somebody wants to engage in a debate, Aurielle put it the best, take it off. It's because somebody truly believes that there's metal in that syringe. And you're not going to win that argument by typing. You are going to have rational conversations, and rational conversations don't happen online. They don't happen unless trust is built. You recognize their opinion. You admit that conceptually, maybe it could happen, but let's walk through why it's not there. And I think that's really important for all of us to be taught and retaught, because for about 6 years, maybe longer, pre-pandemic, social media was it was a benign, awesome tool outside of election periods, filled with pictures of our kids and our kittens. And, now it's weaponized, and we have to treat it as that.
Thank you. That is an amazing response, and definitely great advice that I think hopefully all our listeners and everyone who's joining us this morning can take away. So we have some people now, I'm sure, who are excited, right? They feel a little bit more comfortable. We've hopefully answered some questions. Aurielle, where do we go, right? How do we now get vaccinated? How do we now go get tested if we're not feeling well? Could you direct some of our audience into some of those resources that are available locally here?
Yeah, so I would say I'll start with us here, Madison, Dane County, but there's tons of resources out there. So I also encourage Dr. Williams and Dr. Rye, if I miss one, please jump in. So here locally, we have our local health department, Public Health Madison, DaneCounty.com. It's something along those lines. If you just Google it, it comes right up. We have a map of vaccine locations, and we also have a map of testing site locations. We are conducting both. We are also standing up Alliant Energy Center again. It is currently operating 5 days a week. And we, as I mentioned earlier in the call, we are preparing for pediatric mass vax. And so we will also be supporting those efforts with our healthcare partners. That being said, there are also a number of clinics right now from our healthcare providers in Dane County that are offering ongoing testing and vaccination options. And so I would encourage everyone, if you have a primary care provider or that kind of helpful health hotline, as I like to call it, that a lot of health systems have, to give them a call, see if those are your options. If not, pretty much every local health department in the state has some outreach materials on their website to say, here's where you can get testing, here's where you can get vaccination, even if it's just a phone call to try to connect you to where the closest location might be for you. That being said, Wisconsin Department of Health Services also has a statewide map of testing and vaccination locations. There is a little bit of a lag that occurs with that, but it's kept up to date pretty well. And those show more community-based sites. So I don't believe it lists every single healthcare partner that's doing vaccination, but it does list all of your community-based sites. So whether those are put on by public health or private healthcare entities, those are all mapped out to statewide. That being said, yeah, if you're ever stuck and you're like, I need a COVID test or I'm ready for vax, but I maybe have more questions, I would say definitely reach out to the health department. We know jurisdictionally kind of where and what the landscape is around testing and vaccination in our individual jurisdictions.
And also just to quickly, if you don't have commercial insurance with a primary care, maybe you carry another payer, could be Medicaid, Medicare, or maybe currently you're not able to access the help based on immigration status or maybe even language barriers. Are those same resources available at all those locations, or are there very different resources for people to access in order to get more information and get access to vaccines?
Great question. So in Wisconsin, none of us as health departments require insurance of any kind, nor do we ask about insurance status. That also goes for immigration status. So I'm glad you gave me the opportunity, because I want to make this as clear, and I really want to make sure everyone is aware of this. We do not ask immigration status. We do not ask for a license or ID to verify. The only time we might ask you is if we're having trouble spelling your name for your vaccine card, but you can produce whatever has your name on it to help us out with that. It does not have to be an ID. So please don't let that discourage you. And if you do have questions, comments, concerns about that, please reach out to your health department. They are there to help and serve the people of Wisconsin.
And Kinglsey,
Thank you so much.
When it comes to our healthcare providers, if we've agreed to give a vaccine, we've also agreed to go with all of those rules. So what public health actually, as vaccine providers, when we sign up to be one, we agree not to discriminate around insurance. We definitely, don't discriminate around immigration status. Actually, purvey exam rooms all have a sign that refer to us as a safe harbor, and that your immigration status will not be used or asked for, while you're sitting in this room. So we try to put that information out, but it's important to understand that if you've agreed to be on the COVID-19 national team, you've agreed to all the rules that public health just explained.
Oh, that's great to know. Was not aware of that all healthcare had signed up for that, to kind of follow those same guidelines. And I think that's hopefully helpful for people who are listening as well, who may have friends or relatives who may not feel that they can access this because of a financial barrier. That barrier does not exist. So please, seek proper care, proper education, so we can keep everyone safe. What are some things that we may have missed? Dr. Williams, Dr. Ray, or Aurielle, is there anything that you want to be leading a statement to kind of end with today for our audience?
So I think what I would like to address, are some of the common myths that we hear in the vaccine, and try to dispel those myths as much as possible. And again, it's based on the conversation that we've had here this morning. It's about information, right? And not affirmation. And people need to change their mental focus, I think, from that mindset again. I would say, we've heard, like I've alluded to earlier, I've heard some doozies, right? You have mentioned, the microchip in the vaccine. Well, I would rebut that with a little humor to say, how much those vaccines would cost if we had to put a microchip. and secondly, as Dr. Rai he held up his cell phone. We don't need any microchips to track people more. I don't know anybody even my age and older that doesn't have their cell phone on their hip, even when they go to the bathroom. Okay, so if they want to spread us, they can do it right through our phones, through our TVs. We don't need tracking devices anymore. That's completely absurd. Another one is and I think Ms. Smith and Dr. Ryan both mentioned this as it relates to infertility. Okay, that was a bombardment of disinformation early on when the vaccine came out. Oh, it affects fertility and we don't want, and where those disinformations originated from, is beyond my knowledge and all of that. But, suffice to say that this is certainly not true, probably one of the more harmful myths out there related to infertility. Another one that I heard, and I think everybody will agree, is it affects my DNA. It's going to change, people say, oh, you got the shot. When did you get the shot? Has anything happened to you? Have you noticed anything? Like, did you grow a third arm or did you pop an eyeball out of your forehead or something like that? No, it's not a DNA virus. It's not a DNA vaccine. And, for people who don't have a basic understanding of cell biology, it sounds plausible, but understand it really isn't. RNA is just a message, right? That's why they call it messenger RNA. It goes into the cytoplasm, it attaches onto a ribosome, it makes a protein. That protein gets displayed on the cell. The body recognizes it as foreign and makes an antibody against it. It doesn't enter your cell nucleus. It doesn't change your DNA. It's not going to make you infertile. You grow a third eye. You don't have a tracking device in there. And and as far as I know, at least as far as Moderna and Pfizer are concerned, there's no particles in these vaccines whatsoever. So you cannot get COVID from a vaccine, much like you cannot get the flu from a flu vaccine. You can get flu-like symptoms or COVID-like symptoms. That, again, as I alluded to earlier, it tells you that the vaccine was actually vaccine and that your immune system is working appropriately. And so, again, and I think my final, liver shot to the fight here is, again, you're supposed to get some side effects. That's what vaccinations do. And I would also say this as well. When you look at the lines, and this is to my folks of color, when they talk about historical distrust and things like that, I want you to look in that line and see who's in that line. There's Black folks, white folks, Asian folks, Native American folks, Indian folks. They didn't make a separate vaccine for Black people versus brown people versus white folks. Okay, it's all the same vaccine. So, you should dispel that myth from your mind. They're engineering these to wipe us out 20 years from now. No, everybody's getting the same vaccine. There's no special vaccine. There's no separate line. There's no separate anything. It's all the same vaccine. So understand the vaccine is safe. It is effective. Please get it if you haven't gotten it.
Dr. Ryan.
I'll chime in on, the myths that we hear. Obviously, infertility is one that was used and it's been promoted primarily because it worked, right? So once again, what's the algorithm or the bot doing? It's taking something that's working, especially affecting the working force and working women, especially those in the Black and brown communities who already have trust issues when it comes to fertility. And let's just amplify it because it worked. And if it didn't work, it wouldn't be spread. One of the other ones I hear a lot from men, and I think a lot more from friends who are of color, is impotence, that the vaccine can cause that. I'd like to point it out that, millions of shots delivered to men has not done that. But COVID does, when you get infected, one of the long-term effects is impotence that is not responsive to our normal medications, such as Viagra, et cetera, and it can be permanent. So not a bad reason to get the shot. And I'm just, being straightforward, with friends out there that are listening. That's a pretty darn good reason to get the shot. It's important, though, that we answer your questions. And it's okay to have these concerns, but it's best to have a one-on-one conversation with somebody that knows what they're talking about. And somebody that you can just talk plainly with. And physicians, nurses, whoever that may be, but make sure they know what they're talking about. And we can walk you through the science, if that makes sense. We can walk you through the myth. And yeah, there's some doozies out there. There's some interesting ones where I scratch my head and trying to figure out how the heck did somebody even come up with that? Somebody came up with it because it worked. Somebody came up with it because it got traction. And that's why it's getting spread. That's how misinformation works. And that's how you destabilize our communities. I mean, our Black and brown communities. That's how you destabilize the country. That's how you keep this pandemic going, right? You do it through misinformation at this point. So it's out there because it works. And those of us who are trusted people need to recognize that and find good ways to explain that through that people understand. And recognize the fact that somebody fed them this because it works.
Thank you.
Yeah.
And Ms. Smith, we'll end with you. Please, some advice for our viewers.
Yeah, well, I think kind of going with the theme, my favorite or least favorite, however you want to put that, myth we've had to debunk recently is that public health has this nationwide conspiracy that we've placed COVID into all of the face masks that are being produced. And that's actually how people are getting them. That is 110% not true. I can verify public health is busy doing various other things and nothing to that extent. And so with that, I think it's just, as everyone has said on this call, right, it's so important to just find factual information for yourself and really connect with your trusted individuals in your sphere to get that information. And that being said, I just echo the theme of it is really critical for us as a people of color to take this virus seriously and really do what we need to do to protect ourselves. I can't stress that enough. I'm a big history buff. That's my personal anecdote. And for as many people are like, oh my gosh, we haven't seen anything like this before. We have. I was not on this earth when it happened, but we have. We've had pandemics before, the 1912 flu pandemic. That's the best body of knowledge we have to combat what we are seeing today. And we have learned from that. And I really encourage everyone on this call to learn for yourselves how we can protect ourselves, because the vitality of the Black community in America is critical and we need to protect ourselves. So do what you need to do to protect yourselves, to protect your loved ones. We've got to come out of this alive, and we've got to come out of this stronger than ever. And I believe that we will.
Thank you so much. And I'm so grateful for the three of you. Because honestly, I truly feel the information that's shared today will actually help, right? It's going to help improve our communities, and it could even go to save someone's life. And if we can do that, then that's really what we're here for. Thank you so much today. I've heard a lot of things. I just want to recap a couple of things that I heard that I'm going to be taking away personally. One, it's okay to have some conversations. Where we have the conversations, it's important. And Dr. Rye, I really appreciate that. In those spaces, whether it's our churches, it's our community groups, but have those conversations, but make sure we have those personally, one-on-one, face-to-face, and so we can have healthy, good conversations and inform people of the options and the opportunities here. I think another thing that I heard is that a lot of these myths that we've heard are actually just that, myths, right? And they've been placed there for various of reasons that we've heard today. It could be economic, it could be racial, systemic in nature, especially when the virus first started. But they're myths all the same. And the best way to dispel those myths, again, is to go back to that first step, which is have conversations. Reach out to public health, reach out to your healthcare provider, and truly get the answers that you need in order to keep yourself and, more importantly, your communities and your loved ones safe. Last but not least, there's opportunities to join in on this, right? So if you're sitting and listening at home and not knowing how you can help support this, Aurielle has shared some great opportunities in where there's information that you can access and share that information. But most importantly, if you have the time and the ability, we have a strain system. And we're in for a pandemic that's going to last several more months. And how can we then help support that system to make sure that there's individuals there to get masked out, to have our flu clinics, and to support those who are really in the fight. Once again, I want to thank Madison 365 and the sponsors, as well as our panelists, for this amazing conversation this morning. Thank you very, very much.
This is 365 Media.